It is my pleasure to introduce Senator Barbara Boxer of California.
Thank you so much. What a warm welcome. I just want to say, if you're from California, raise your hand. Whoa! Wow. Well, I just want you to know something which you may not know. I am convinced that the first time I ran for the Senate in 1992, nurses got me elected. I'm convinced of it because the way we figured it out, 1 in every 4 Californians had some connection to a nurse. Either they were a nurse or married to a nurse or their daughter was a nurse or whatever. And I had such support from the California nurses. And I just want to say, just between us, when you stood up to our governor, when he tried to give you a hard time, I was so proud of you, and I was so proud to be a woman, and I was so proud of your strength. So for me, coming here today is just such a treat, and I was thanked for coming. This is an honor for me, believe me. We are marking the end of National Nurses Week, and I do want to express my appreciation as, not just as a senator, but as a mom, as a grandmother, for the work that you do for all our loved ones, for caring for the patients and for their families who rely on compassion and care. I thought it was interesting that President Obama said in the next Supreme Court justice, he wants a quality that all of you have, and that's empathy. Empathy is a quality that you have to have when you go into your field, but it's also a universal spirit that we need to have in every walk of life, including at the highest court in the land. So you're setting the pace for what humanity really ought to be. While we celebrate nurses this week, but we have to also acknowledge that too many nurses are overworked because of staffing levels that are simply inadequate. And we had this big fight in California. For decades, you've been telling me that there are not enough nurses, especially in hospitals. And study after study shows there's simply a national nursing shortage. By 2020, it is estimated that the demand for full-time nurses will exceed supply by 1 million nurses. And this is unacceptable. We must address a problem that affects quality care, and we have to address a problem that is driving too many nurses away from the hospital bedside. There's just so much, a person can do. And I know just caring for family members when they're really sick, the toll it takes on you. And we don't want nurses to become deadened to the whole humanity thing. And if you're so overworked, it's not going to be good for you or the patients, that's for sure. So I am pleased to announce that I have introduced today the National Nursing Reform and Patient Advocacy Act. We're very excited. Yes. It's exciting. And what I want to say is, what I want to say is, thank you for asking me to be the author. You understand? It makes me proud. And this bill will not only help address the nationwide shortage of skilled nurses, it will improve the quality of health care for all Americans. The legislation champions nursing rights, nursing ratios, and nursing reform. And I would argue this legislation represents patients' rights as well. Yes, because this bill protects the rights of nurses to speak out for patients and to speak out for themselves without fear of discrimination or retaliation. If there is a problem in your hospital, you should not only be able to talk about it, but you should be able to do something about it. That's part of your job, and you shouldn't be punished for doing the right thing. So, second, this bill sets minimum nurse-to-patient ratios because patients will simply not get that high quality of care if nurses do not have the time to provide it. It's a no-brainer. It's very, very simple. We understand if you're running around and have all these problems, you're just simply not going to be able to give the care that you want to each patient, and the patient can suffer mightily because of that. And finally, what this bill does, it creates a registered nurse workforce initiative that invests in the education of nurses. And because we know that medicine, just like more than almost anything else, is changing every day, right? And what was good practice 10 years ago is not good practice today. And you know now with all the technology, you have to keep up, you have to almost be an engineer today to do your job. And therefore you need the training. So we know that President Obama has made improving patient safety and quality care a cornerstone of the health care reform effort. And I want to make sure when we take up health care reform that you are at the top of the list of concerns. Otherwise, we can't do what President Obama wants to do, which is to make health care accessible, affordable, and quality. And if we make mistakes, it's so costly, isn't it? So if you pay up front to educate our nurses and give them the continuing education and give them the ratios, then we can truly build on this. Now, a poll of nurses nationwide found that almost, this is really something, half of nurses plan to quit their jobs, I'll say this again, found that almost half of the nurses who plan to quit their jobs say that inadequate staffing is the reason they are leaving. It's no different than any other field. It's no different. Now, I have to represent 37 million glorious Californians, and I love each and every one of them. How could I do it without a staff? Now, I have, frankly, a pretty small staff when you consider how many people I have to represent. But if I had no one, how could I do it? How could I even understand this issue? I have to have experts in every field. If I don't have that, I can't be effective. And you can't be effective if you're so overworked you don't even know what day it is when you wake up in the morning. Now, here's the thing. The cost of replacing these valuable professionals when they quit, the cost of replacing them has been estimated at $25,000 to as much as $60,000 per nurse. So in other words, when an experienced nurse leaves, you have to now teach somebody else everything. How does that hospital work? How does the record keeping work? You know as well as I do the training that it takes. So we need to retain nurses, not lose them. And that's why we need this bill. It's so important. Now, I told you about my nurses in California, and I told you how brave, I'm sure you're not surprised because you probably know them from this gathering, how brave they are and how strong they are. And 10 years ago, they fought a major battle for their patients and for themselves. And the results were this: minimum nurse-to-patient ratios at California hospitals. They won that fight. And here's the thing. We now know how right they were. Reports on the California ratios have begun to show what all of you nurses already know, that setting a minimum standard for safe staffing can be the difference between life and death for patients.